Hi, this is Dr. Terry Frankovich. I'm the health officer for Humboldt County. I wanted to speak with you for a moment today about what we can all do to help prevent the spread of COVID-19 in our community. I want to emphasize that public health still recommends all of the measures that we've been talking about since we all first heard about COVID-19. Those measures that we can all use day to day, such as good and frequent hand washing, covering your cough, staying home when you are ill, and also doing the frequent cleaning within your home of those commonly used surfaces that can help decrease spread. In terms of staying home, I want to emphasize that people who have mild respiratory symptoms, especially, and we see a lot of that at this time of year in Humboldt. In fact, we still are seeing quite a bit of circulating flu in our community. When you have those symptoms, it's important that you stay home, take care of yourself, and that you remain at home until you either have had 7 days from the onset of your symptoms or you have been symptom-free for 3 days, whichever period is longer. This will help to protect everyone in our community from spread of illness right at this time. So I wanted to just address the issue of social distancing for a moment. It's a term that I think a lot of people never had even heard of before we started trying to address the COVID-19 outbreak. Social distancing is really a public health tool that is used to help to prevent or to slow the spread of an infection within a community. There's a whole toolbox of things that can be used in social distancing, and those began with things like recommending people avoid large gatherings, particularly if they were medically fragile or older. That toolbox that we are implementing can also include things like closing bars, nightclubs, those types of venues where people who are not normally in proximity to each other come together in a single place. It can also mean canceling mass gatherings, such as concerts and events, and we've been seeing that happening across the country as well as locally. It can also mean changes to how casinos, for instance, operate in terms of the number of people on site and social distancing measures that are used in those settings. So when those tools are implemented depends on where we are in the outbreak and how effective those tools are likely to be at that moment, as well as looking at the social consequences of what we're implementing. Public school closure is another social distancing tool that can be effective. Humboldt County Public Health understands the difficult decision that our schools faced as they tried to make decisions about closing or remaining open. In light of the closures that have been announced by the schools, I want to just note that we support the schools in their continued work under these circumstances to really have and put in place innovative solutions to create ongoing learning for children during this time, to ensure that children have access to the food that they need and normally get in the school setting, and that the schools are working to assist with supervised child care options as best they can. This is a circumstance where, again, we look at implementing tools on a continuum. There may be some additional measures that occur down the road, but we understand that these current measures have a profound impact on families and children and businesses, other entities throughout our community. So it's really important that we implement them as needed. I think the governor has signaled that this is the time for a lot of these large-scale measures, but it does not negate the fact that we all need to also be doing those ongoing things within our own community to help decrease transmission across the board. For more information about COVID-19, please visit Humboldt Health Alert at humboldtgov.org/Humboldt Health Alert. For medical questions, please contact your healthcare provider. And if you have non-medical questions related to COVID, please call the Community Information Line at 707-441-5000. Thank you.